And the other thing that we bought a tremendous amount of is the hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs. And in the meantime, it's been around a long time. It also works very powerfully on lupus. If you have no signs of heart problems, the azithromycin, which will kill certain things that you don't want living within your body. It's a powerful drug. If you don't have a problem, a heart problem, we would say, let your doctor think about it. What do you have to lose? What do you have to lose? And a lot of people are saying that when, and are taking it, if you're a doctor, a nurse, a first responder, a medical person going into hospitals, they say taking it before the fact is good, but what do you have to lose? They say take it. I'm not looking at it one way or the other, but we want to get out of this. If it does work, it would be a shame if we didn't do it early. But we have some very good signs. So that's hydroxychloroquine and azithromycin. And again, you have to go through your medical people, get the approval. But I've seen things that I sort of like. So what do I know? I'm not a doctor. I'm not a doctor.
You do promote these medicines extensively here. How do you not go so far as to be giving medical advice? And you said yesterday you might take some of these medicines even though you don't have symptoms. Are you still planning to do that? And how do you calibrate being enthusiastic and not playing doctor?
Because I want people to live, and I'm seeing people dying. And I've seen people that are going to die without it. And you know the expression, when that's happening, they should do it. What really do we have to lose? We also have, this medicine's been tested for many years for malaria and for lupus, so it's been out there. So it's a very strong, powerful medicine, but it doesn't kill people. We have some very good results and some very good tests. You've seen the same test that I have. In France, they had a very good test. They're continuing. But we don't have time to go and say, gee, let's take a couple of years and test it out, and let's go and test with the test tubes and the laboratories. We don't have time. I'd love to do that. But we have people dying today. As we speak, there are people dying. If it works, that'd be great. If it doesn't work, we know for many years malaria, it's incredible what it's done for malaria. It's incredible what it's done for lupus, but it doesn't kill people. That's one of the things with a vaccine. When we have a vaccine, we have to do tests, because when you inject that vaccine, when they take whatever it is they have to take, we have to make sure it doesn't have a horrible impact, destroy somebody. Could. So we have to test it for a long period of time. This one, not so much, because it's been out there. Now, I'm not acting as a doctor. I'm saying do what you want, but there are some good signs. You've read the signs. I've read the signs. With the other one, there's some very good signs also. Different, going together works very well. But there may be an indication that if you have a problem with your heart, you shouldn't take what we call the Z-Pack. You shouldn't take it, and that's okay. But I would love to go to a laboratory and spend a couple of years testing something. We don't have time. We don't have 2 hours, because there are people dying right now. If it does help, great. If it doesn't help, we gave it a shot. We gave it a shot. That's the way I feel. You know, we pass something. Yeah, I would be very serious about taking it. Take it. And you know, we've had some unbelievable results. Unbelievable results. And it also gives the people hope. Yes, please.
Mr. President, the doctors who are treating coronavirus patients, they have the medical expertise to determine whether or not they should prescribe hydroxychloroquine.
And many of them
And
do.
there are already clinical trials in place looking at hydroxychloroquine.
Sure.
So
They should be finished in about a year.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not. I'm just
You
saying
come
very
out here-
simply, I'm not at all. I'm not. Look, you know what I'm trying to do? I'm
Well,
trying
you
to save
come out
lives.
here every day, right, sir, talking about the benefits of
I want them to
hydroxychloroquine.
try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it, nothing. Because we know long term what I want to save lives. And I don't want it to be in a lab for the next year and a half as people are dying all over the
It's already
place.
out there. Doctors are already able to prescribe it off
That's
label,
right. All I'm doing
So what
is
do you
saying,
accomplish?
well, I'll tell you what I accomplished. We bought massive amounts of it, 29 million doses of it. Now, it may not work, in which case, hey, it didn't work. And it may work, in which case it's going to save a lot of lives. Now, a lot of people say if the people walking in prior to getting it, if they take it, it has a profound effect. Well, maybe it does, and maybe it doesn't. I don't want to wait a year and a half to find out. And only CNN would ask that question. Fake news. Go ahead.
Sir, I will.
Fantastic question.
And would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah.
Well, I'd love
Maybe
to hear from the
15.
doctor.
15 times. You don't have to ask the question.
He's your medical expert, correct?
He's answered that question 15 times.
Dr. Fauci, why are